You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Welcome to the final episode of season 6. I am super excited today to be joined today by an incredible colleague and mentor, Dr. Robert Lucero. Dr. Lucero is an Associate Dean of Equity, Diversity, and Inclusion, a full professor. Dr. Lucero is also the inaugural Adrienne H. Moseley Endowed Chair in Diversity, Equity, and Inclusion at the UCLA School of Nursing and maintains a courtesy faculty appointment at the University of Florida College of Nursing. He is a fellow of the American Academy of Nursing and co-chair of the American Medical Informatics Association's Diversity, Equity, and Inclusion Committee. As the Associate Dean of EDI, he is the Chief Diversity Officer representing the School of Nursing at UCLA, as well as within the University of California system. He is responsible for leading the school in their vision to be a beacon of creating innovative, impactful, and sustainable individual and organizational strategies and solutions that promote a diverse, equitable, and respectful environment for faculty, staff, students, alumni, and community partners through interdisciplinary research, scholarship, clinical care, and community engagement. As a scientist, Dr. Lucero's program of research focuses on improved health outcomes of vulnerable populations using innovative health system and informatics approaches. Two prominent themes of his work are enhancing the equity of care for hospitalized older adults and improving self-management of chronic health conditions among Hispanic, African American, and LGBTQ plus populations. Welcome to the show, Dr. Lucero.
Thank you, Ali.
Fantastic to have you here. I'll start with the question that I always start with all my guests is, how did you get started in the world of nursing?
By luck, I think. No, I'm not a luck believer, as most people who know me. It was by what I like to say, ordered chance. And so I actually had intended going into primary school education. And it just so happened I was hanging out with my cousin and one of his buddies in between classes one day at Arizona Western College. And we started talking about what we were studying and what our degree major was at the time. And this guy, it turns out that his dad was the CEO of the hospital in Yuma, Arizona, the same one hospital that exists there some 25 years later. And he just started sharing how he was in nursing school. And I was like, what is that? And what is that all about? And so he gave me the lowdown. And I think a month later, I applied for the program. This was like in the spring, of that year. And by March or April, so a few months later, I knew I was going to nursing school. So that's how I landed in nursing. I knew it was a good paying job. We hear that a lot, right?
I do. It's strange you mentioned. I mean, it's not strange anymore. I think for so many years, like I've always heard from individuals like, oh, nursing is a calling. People know it from when they're little or they're, and it is, I think it is a calling, but so many people I speak to, and especially through the podcast, I've heard it like firsthand from so many people that nursing was not the first choice. They had other plans and nursing just came to be. Very few of my guests have actually said, I've known it since I was a kid that I was going to be a nurse. So it's no longer strange that I hear people's first, just like myself, I was going to go into PA school. And then things happen. Same thing. A friend of mine talked to me and said, "Hey, what do you think? What about nursing?" I'm like, "Let me look into it." And here I am. So
Yeah,
very
but for me,
cool.
it wasn't even a second, a hundredth choice. It was like no choice. It was just I heard this guy talking about how he was going to be done in 2 years and have a good paying job, and I was like, okay, sign me up, because this whole experience of being derailed from what I thought I was going to do, which was become a civil engineer. I just thought, let me get out of this experience of, not to disparage community colleges. Community colleges are amazing. I'm a huge proponent of community colleges, but when you're in your late teens, early 20s, and things aren't going your way, you kind of have a different perspective. And I was like, I just want a job, and then I'll figure it out after that, a good paying job.
Right.
So yeah, it was not a calling, it was not a choice. It was just very practical and concrete for me. I knew
Yeah.
nothing about what nursing was. I just knew 2 years done, good paying job.
So are you a graduate of an associate's degree program?
I am.
Or did you transfer into a
So I finished my associates in applied science, and then
okay.
in Arizona, that's what you need. Well, at least then needed to qualify for your license. So yeah, I
Okay.
graduated from an associate degree program.
That's fantastic. So how was it at the time you went to school? How was it for you to get into, since nursing was not on your radar at the time and you decided to go? How was it going into the nursing profession for you?
Do you mean after graduation?
Well, during school and then graduating afterwards. Yeah.
Well, I mean, I love to tell the story that, I was basically told shape up or ship out in nursing school. And I
If
was
they could
told,
only see you now.
I was told, you'd be an amazing nurse. I've seen you with the patients, but your care plans suck. So yeah, that was my experience in nursing school. And I thought, well, I can't fail this. I mean, going into it, there was the whole thing, which still exists, the waiting list. And
Right.
when I got into nursing school 2 months after application, I was like, what waiting list were they talking about? How is that possible? But that transition from nursing school to practice was one, again, I had no conception of what it really meant to be a nurse.
Mm,
What it really means to be at least the conception that I have of it now. And at the time when I was finishing my training, my associate's degree training, I was a behavioral health tech in a freestanding acute care psychiatric unit. But and it was intriguing to me, but it wasn't really what I found fun. So I have this philosophy: if you're not having fun at work, find a new job,
right.
especially as a nurse. And so what I did find fun, and then of course I did well, you got to apply to a med surge. This was 25 years ago. Keep in mind, a little bit more than 25 years ago. You've got to apply to a med surge unit. And then the other thing I found kind of interesting was just the whole rehab facility. I don't know. I don't remember why at the time. I just thought, it just seems, I think it was more because they didn't have like that shift work, right? It was a
Right.
different kind of shift work. And so it was more like 5 days a week, 9 to 5 type thing, as I recall. But the place where I found like the most joy when I went to school was labor and delivery. So I thought, gotta apply there. That's like, if I'm gonna
Mm.
have to work, I'm gonna work there.
And as a male nurse, it's not something you hear too often.
Yeah, no. And so, and even still. And
And
so,
even still.
yeah. And so I, I was doing my occupational, behavioral rather, tech job, and got licensed, transitioned to a nurse on that unit, and was waiting to hear about the other options. And so I got a call, and they said, we'd like to offer you a job in labor and delivery. And I was like, cool beans. I overlapped a little bit between the psych mental health and the labor and delivery, and realized that I needed to focus on the labor and delivery to really be good at it. So I stopped that other job and focused on the labor and delivery. I mean, I don't know how things happen so much for new nurses now, but at the time, the hospital, at least the labor and delivery unit, had a very structured preceptorship. And so we did 12 weeks of in class learning everything they thought we needed to know about, from the unit structure to the equipment on the unit to and then a lot of didactic learning on labor and delivery, in terms of reading the fetal monitor and uterine contraction tracing and how to respond. And then, of course, all of the quote unquote high-tech equipment that's used in labor and delivery. And then after that, we had a one-on-one on the unit. So we would get scheduled with our preceptor when they worked. And that lasted, well, we were told it could last up to 12 weeks. And so if your preceptor thought you were done sooner than that, then you didn't have to go the full 12 weeks with your preceptor, and you could start, working your own schedule. So yeah, all of that with an associate degree.
That's amazing. So what made you, obviously you went on with your higher education. What made you want to go to that next step and go to your bachelor's and so on?
Well, I wish I could say that the thing that motivated me to go back to get more schooling again was a intentional, thoughtful process. But it wasn't. As you've come to know me, Ali, and my friends and colleagues know me, I'm a God believer. That's why I say ordered chance. I don't think anything happens just by random nothing, just complete randomness. And I had not been living at my so when I finished my associate degree program, shortly after that, I moved out of my parents' house. I'm grateful for them for supporting me in that, that part of my journey. And I had been working full time, maybe for about a year, maybe less than a year, and living in my own place. And I would go over to my parents' house to visit and get a free meal, of course.
Of course.
And so they and I had not received any postage like at their house that my mom or dad would just give me and say, oh, look, this came in the mail. Tell them to stop sending stuff to the house, right? That had stopped a while back. And one day I went to the house and my dad was like, hey, look, this thing came for you in the mail. And it turned out it was a piece of postage from Arizona State University soliciting applicants for their RN to MSN program. And I thought, oh, well, that's interesting. You can go from an associate's degree to a master's. Wow, how do you do that? Right. And so I read about it, and it was pretty clear in there how it happens, or how it happened then. And I thought, oh, there's no chance, because I'm not a grades guy, I'm a learner guy. And I just, as long as I'm learning what I need to learn, the grades are the grades, right? And so I called them up and I just wanted to talk to them about the whole grades thing. And they said, don't worry about it, because when we evaluate your transcript, we're only concerned about math and science. And I thought, perfect, math and science, I'm in. And so they said, send us your transcript, just an unofficial copy, and we'll review it, and we'll let you know as soon as we're done with that. It wasn't very long after I mailed it to them that they said, yeah, you have the GPA, the minimum GPA based on your math and science. Please submit your application. And so that's how it happened.
Wow.
And that's
Awesome.
how another chance thing. And what's crazy is every time along the journey of me getting more educated, it was very quick. It was super quick. So in that in that instance, I applied in the fall, and by January, I was already living in Phoenix, Arizona. Like
Wow,
months later. Yeah, it was a
very quick turnaround. I don't think it happens that fast anymore for any school, but so your master's degree, how did you choose what area of specialty you're going to step into?
Okay, the listeners are going to think, man, he's got way too many long stories, but they're like they're like these complex experiences. I had created this whole plan because I loved being a labor and delivery nurse. I loved the idea. So in Yuma at the time, it was the hospital labor and delivery experience for nurses was a what we call a level 2. And so we only took care of women who were at least 32 weeks gestation. If they came in earlier through our labor triage, we would transport them to Phoenix. It very much was a community hospital where the physicians, there was no such thing as an attending. The physicians would come and do their rounds in the morning, and then the rest of the day, it was pretty much just, it was all nursing. It was all nursing management, unless there was, a reason for concern, and then you'd pick up the phone and, or pay. Oh, back in the day when we would page physicians. I don't even know if that exists anymore. Anyway, I feel like I'm dating myself, but that really wasn't long ago. Well,
Technology has moved very
maybe it
quickly.
was, maybe a quarter of a century is a long time. But anyway, so the nurses were managing the laboring experience in large part, unless there was a reason for concern. We had a lot of standing orders, even though the physicians weren't there. In Yuma, at the time, at least 50%, if not more, of all vaginal births were attended by certified nurse midwives. So I just was like, man, I want to be a midwife. I want to be the person running the show. Right?
Makes sense.
And so my master plan was, I'm going to go to Arizona State. I'm going to get a master's degree in nursing with an emphasis in family practice. It's going to be a family practice APRN.
Right.
Because I had already done the homework that I could go back to Yuma, work in an OBGYN's office, do women's health, and do a postmaster certificate in midwifery through USC. And the University of Southern California at the time had a distance learning program where you could basically just do all of your clinical experience and everything in your hometown. And they would come to your hometown and do your, I guess, checklist. I don't know.
Right.
And make sure that you were competent. And so that was the master plan, but that's not what happened, clearly. I fell in love with nursing theory and the idea of theory as the basis for everything that we do as nurses. And I pivoted from being a family nurse practitioner to focusing on community health as a community health nurse. And at the time at Arizona State, they had a master's of science and a master's in public health. And so I asked, what does that mean? And what would it mean in terms of graduation? And they said, a semester longer. I said, well, shoot, I've got to be here 4 years. What's 4.5? So.
So you ended up with your master's in public health and an MSN.
That's right. A master's of science and nursing.
You did a dual degree.
Dual degree. I did a triple degree, actually, right? Because I did the
your
bachelor's. I got the bachelor's like in a year and a half, and then I did the master's of science and nursing and the master's.
MPH. Yeah. Now I see a lot of nurses, not a lot. Actually, I had quite a few of the guests I've had on the show with a master's in public health. How do you think that content benefits you now as a nurse scientist or in your career overall? Because I've dabbled with that in my head several times, just haven't sort of pull the trigger on it. But how do you think that's changed how you practice or how you view your practice?
So I don't know that it does two things. It does exactly what you said. It helps me, it gives me a different multiple lenses to think about the human experience of health and illness on a continuum. And then it also helps me understand other professions,
Right.
namely the profession we mostly collaborate with, which is medicine. A master's in public health, its focus is really on the disease model, which is that epidemic, and more specifically, the epidemiological model of host, vector, and illness, right? And so host, vector, and environment, excuse me. And so, nursing is not about illness, right? Our one could argue that our model is on health, right? And so that epi model really focuses on the vector as the thing, causing illness, and there is no health in that model. So it helps me consider how I, as a nurse, need to respond, right, based on the management of health and the promotion of health in a different context, right? So
Right.
people can be healthy, right, with chronic illness, so-called
Yes.
chronic illness, right? I don't call it chronic illness, but you're asking me, how does this all come together? I consider it just a chronic condition, right? So
Right.
if it's not anything that we're going to cure, then why would we call it illness? It's just there. It's just part of who we are. It's just part of our human
You live with
experience.
it.
Right. That's
Right.
it. Exactly. So the master's in public health, the master in public health is a helpful degree, I think, in terms of thinking about reality in a different way. Would I recommend it for nurses? Only if you're not getting a master's in community health.
Mm.
Only because if you think about our other master's degrees, right, they're very clinically focused.
Right.
I mean, I would even argue if you're getting a master's degree in a clinical specialty, you're already getting the master's in public health in some way, because it's so illness focused.
Right. Right.
Based on my
Very true.
understanding. Yeah.
Very
So
true. All right. Well, thank you. I have, as you went through your process of your professional development, at some point you decide you're going to do your doctoral degree. So how did that come about? And during any of your processes of going through your professional development process, did you have anybody that you were able to consult with or a mentor throughout the process that you reached out to? Just from my own perspective, and one of the reasons I created this whole RN Mentor podcast was I had difficulty as somebody who was post-military coming into the civilian sector. I always had difficulty finding mentors. So did you have anybody like that in your career process and into your PhD program?
So I would say to anybody out there who doesn't have a mentor, the sign of a good mentor is someone identifying something in you and encouraging you to build that in yourself. So I have amazing mentors who have become amazing colleagues and amazing friends. Sometimes it's kind of awkward thinking back, and I'm going to call out some names here because I think that there's value in names, identifying people who really matter to me. So Dr. Jacqueline McGrath, she was the first person who saw something in me that I didn't even know was there. And this was back at Arizona State University. And she is now a friend and mentor and colleague. She's at UT Health Sciences San Antonio. And it was in my first course that I took at Arizona State University, nursing course, because I had other courses I had to take. It was the end of class, first day of class, and she comes up to me and she says, send me an email because I'd really like to talk to you about something.
Mm.
I was like, okay, I'm in trouble already, and it's the first day of class.
Hey, what?
And so I sent her the email. Long story short, she identified in me that I should go get a PhD, and she even named where I should go, which is her alma mater as well, you know. And so I just toyed around with the idea because she wouldn't let me forget about it the whole time I was at Arizona State. So
Wow.
I think, first of all, for people who are coming up in nursing, that if someone calls out something in you, really explore that in yourself, the idea, because you might be surprised where that takes you. I think sometimes we have a tendency as humans to not trust what others think about us and think that we have to figure it out for ourselves. So this is interesting because I tell people I have trust issues. Maybe I don't after all, because I really trusted them. The other person I want to put a shout out for her too is Dr. Karen Souza. She's at the University of Colorado in Denver. And she was my master thesis mentor, advisor, who also took a huge interest in me and invested a lot of time in me to get me to go get that PhD. And then the last, just one other person, okay, because these are really important people in my life. I mean, without them,
absolutely.
Without them, I would have never gotten a PhD. Is Dr. Julie Fleury, also at Arizona State University, who also took time to just sit down with me. And it was in my conversation with her that I ultimately realized it was the right thing to do. Because for me, you know, being in school all that time, getting those multiple degrees, I was struggling with this idea of, you know, is experience more valuable than knowledge, or vice versa, right?
Right.
And it was in that one conversation that it just all clicked for me. And I was like, okay, here's another example of the fast turnaround. I applied in November, and by January, I knew that summer I'd be driving to the East Coast to work on my PhD. This was 2003, 2004.
For those individuals that don't have somebody that has reached out to them or tapped them on the shoulder, how about those individuals that are listening right now? What would you say to them in order for them to find a mentor?
Well, you got to take a risk, first of all. I'm trying to think back on, have I ever had to take a risk on identifying a mentor? And I think the answer to that is yes. I think that when I finished my PhD at Penn, the responsibility of finding a postdoc was laid squarely on me. And I'm grateful to another person who I also see as a mentor and friend, Dr. Jeannie Simiati, who's at Emory University in Atlanta, who said, Robert, you should think about going to Columbia. Why don't you reach out to this person? And so I did. I reached out to Dr. Suzanne Bakken at Columbia University, who is also a mentor. And at the time, I don't think Columbia was, the sense that I got, they weren't real sure what to do with me, because my interests were in like nursing data, nursing generated data, which is very much informatics. But I was being trained as a health services researcher at the University of Pennsylvania. it became this thing of let's just have Robert meet with a bunch of people at Columbia, right? But ultimately they did figure out what to do with me. And so that was a big risk for me because it was a whole new experience for me because up until that point, it was kind of like people seeing something in me, wanting to shepherd me. And this time it was more like, okay, I got to go out there. I mean, I'm grateful that they were interested in me, right? Because if they had to at least be interested in me for me to take that risk. The biggest risk in all of that was deciding to do a postdoc in health informatics and not staying focused on health services research. But I'm a real believer in you have to really be in touch with yourself and listen and observe. I mean, you have to use your nursing skills, that knowledge, those different ways of knowing. Just so happens, I already mentioned her name, Dr. Suzanne Bakken at Columbia University, who is a very good mentor of mine, really has helped me with my science tremendously. We were sitting down, and the first thing I did was I pulled out this shiny maroon folder with the Great Seal of Arizona. She looked at the folder. This is when we first sat down to get my day started. I took the train up from Philadelphia to New York City for this day experience to consider this postdoc at Columbia. And she looks at the folder and she says, that's my alma mater. I had no idea that she went to Arizona State University to get her BSN. So, it's the world of nursing, while there's many of us for sure, right? Over 4 million of us in this country, in some respects is really small. And so
it is.
And so, so that was a big risk for me. So I think for people who are seeking out mentoring, I tell my new people who I get newly engaged with, who are assigned to me as students or as new faculty, that we're entering a relationship of advice, right? Mentoring is something that's, in my experience, much more profound than someone coming to my office and saying, hey, what do you think about this? And me giving them my advice, right? Mentoring is an experience of building relationship and trust. And part of that trust is building confidence. And what I mean by that is that if I have confidence in this mentor, it's more likely than not that I will follow their advice.
You have to know where that individual is coming from and get a feel that they're genuinely invested in you, right?
Yeah, I think that's really important, And so I don't think I answered the question about how does a person find a mentor, other than to say, I don't know what that secret ingredient is, right? Because my experience has been one of ordered chance, and one time in my career where I had to take a risk. Right. So none of it was intentional, in other words. Right. So I don't know that I'm the best person to ask that question of, but I will say, based on my experience as a mentor, that if I today, if I were like to switch roles, looking for a mentor, that I would want to find someone who I genuinely think I could like. I think that's really important, like just on a very human level. And knowing what I know now, realize, based on my experience, that everybody has agendas, and that this relationship, this mentoring relationship, is not just about me, but there's got to be something that I can give to them, not just what I can get out of them.
Yeah, I agree. You hit on a key point of risk, but there's risk involved because it is a relationship, and you always have that chance of the relationship not working or being rejected in that relationship, of somebody not having time for you, which I always appreciate when somebody says, my plate is full and I want somebody who's going to be able to give me that time. And I appreciate. But I think you hit on a really key point, is that risk factor that you're like, you enter into any relationship, there is risk involved. And just being okay with taking that risk, because at the end of the day, hopefully you'll match with someone who is genuinely invested in you and help you along the process, because I think that's key. So yes, thank you.
Well, and I also think that, like if I could do it all over again, I mean, I don't know that I would do it differently, but if I were out there looking for a mentor, I would encourage anyone, whatever stage of development they are in their adult experience, to go prepared. Go prepared to tell them what you are looking for, right?
Yes.
What is your agenda, right?
Right.
You see something in this person that you think they can help you with, well, you need to be clear about what that thing is that you want help with.
Right.
And so this makes me, as I'm saying this out loud, it makes me think about Dr. Kristen Shear, who recently graduated from the University of Florida College of Nursing, who I had the privilege of advising, and I would say now mentoring as a doctoral student. She is now, I hope I get this right, Kristen. She is now a lieutenant colonel in the Army. And she was selected as one of 2 nurses back in whatever year that was, about 3 or 4 years ago, to get her Ph.D. as her service duty. And so she had many choices, and she found me. And she was very clear, this is what I need. This is what I want to do, and I need to do it in 3 years. And that's what I would encourage people to do, depending on where you're at in your stage of development as a nurse, right? You're just getting started, if you're going for your master's, whatever it is, right? Have a plan, because I take seriously, and I want all nurses to take seriously, right, that this is a career that we have. And so if you're advancing in your education or whatever phase of your career, of your journey rather, as a nurse, that you think about it as part of a bigger framework of what your goal is for your career.
I want to switch topics real quick and talk about your work in the world of EDI, because as we mentioned in the beginning of the podcast, in your intro, you wear a lot of hats in EDI. How did you decide you're going to fall into this line of work? And let's start from there. How did you decide you're going to do this type of work?
Life always brings interesting twists and turns. And as you mentioned, I still maintain a courtesy appointment at the University of Florida College of Nursing, which is an amazing organization. And I started there back in 2015, and then came to UCLA in 2021. During that journey, COVID happened. But right before COVID, my mother had decided to come and live with me the year before COVID. And in that short period of time, we lost my mother, and I turned 50 years old, and life happens, with all of that. I mean, she died the September before COVID became official. And so I was just left wondering, okay, and I was going up for promotion at the University of Florida. I just started thinking about, are there other possibilities out there for me if I'm going up for promotion to full professor? And I just started looking around intentional. This was the first time in my nursing career that I was about to make an intentional choice about what the next step would be for me. And I thought, okay, well, if I'm going to explore other opportunities, it's got to be on the West Coast, because I think it's time to go back home. So I moved out to the East Coast summer of 2004. So we're talking about 2020. I just knew it was time. It was time for me to come back to the West Coast. All of my family is on the West Coast. And I was looking for opportunities, and there were a few opportunities, and one of them happened to be UCLA, and they had this position for associate dean for EDI. Well, at the time it was associate dean for DEI. We've
Right.
retitled it, to be congruent with the campus leadership on EDI. I saw this position. My passion, as you mentioned in my introduction, is thinking about how we improve health for vulnerable populations, and just became curious about a lot of different things. At this point, we were dealing squarely with the issues around race and gender discrimination, and wondering about my place in all of that as a white, indigenous, Mexican American male nurse, and thinking about what could I do as a leader of nursing, right? I tell my students, once you get your PhD, you're like automatically bestowed in some way role of leader. Now, that doesn't mean you
Right.
are a leader. That just means that you might be thought of one as one. And what are you going to
It's
do
a
with that?
presumptive.
Right? Yeah, what are you going to do with that? And so I've always taken that very seriously, thinking about the future for myself as a leader in nursing. And I just thought, this could be interesting. It could be, my foot into a higher education administrative role. And I could really do something with this, because my predecessor had already set up an amazing structure at UCLA for me to build upon and become a lot more action oriented in terms of diversifying the faculty at UCLA, because the UC system has amazing resources for the public to easily find out what that looks like, and their
Right.
students as well. And so I just went for it. Here I am.
Any of your own personal experiences in the profession, do you think influenced you in taking on a role like this?
So there's a lot of things, right? So I gave you my brief positionality statement based on race, ethnicity, and gender, how I self-identify in those spaces. Yeah, there's a lot of things, right? I mean, do you want me to tell you all of them?
No. I'm just wanted to know did you have experiences throughout your profession? Because I'm an Iranian man in a predominantly female profession, and I've had my share of, and I easily pass as white, even though culturally I don't consider myself white, just because of my background and my culture and how I grew up. I don't always find myself fitting into the white, and I'm air quoting here, the ideas. But from my perspective, I've had leaders that I've had that have been very clear as to how they feel about a male individual being in the profession of nursing. And they haven't always been positive. So did you face some of those along the way that may have said, you know what, I can really bring my own experience from your own experiences, that how you wanted certain things changed? I guess that's where I'm coming from.
So I don't know if it matters as much anymore today, because I haven't had this happen to me in some time. Maybe it's because I'm aging and my identity is more less confusing to individuals, but of course they can go to the web, right, and find me and see what I look like. They can see what I look like. And but my experience has been is that people have been confused by just my physical appearance and not know how to make assumptions about my identity, right? And then of
Right.
course being a male in nursing, making assumptions about all these labels that we want to put on people in terms of sexual orientation and other things, right? And
Right.
so those are very real experiences that I've had I mean, in those spaces, right, of race, ethnicity, sexual orientation. And, as I shared with you and the people who are listening to this, I do lead by identifying as white. My mom was a white European, woman from Spain. I mean, I can't change that. That is part of who I am in terms of my race. The opportunity, though, that we have when we look at our white brothers and sisters, right? Black brothers and sisters, brown brothers and sisters, Asian brothers and sisters, all of our brothers and sisters on this earth, right?
Right.
Is to really just spend time with them in their space and learn who they are. Because
Sure.
because I lead with being white doesn't mean that I am the assumption that you might think that I am, right? My mom, was a very accepting individual. She grew up as a toddler during the Spanish Civil War.
Wow.
And so she had some very, profound experiences of poverty, of indifference, right? Because of the complexity of that time in in Spain's history. And so she brought that to me as her son. And so, the assumptions that people make of one another based on race, ethnicity, gender, the intonation in their voice, the way they express themselves, their mannerisms, right? May be true, but they may be false. And I guess you can't know that unless you have a conversation with them. And so my experiences have been, these experiences that we're talking about, have oftentimes been thrust upon me based on people's assumptions about what they see, not based on anything real that I may have disclosed to them. And I guess we could take the next step, right? So what does that mean, right? Well, I guess it means whatever you want it to mean, in my opinion. I mean, that's the way I've processed this based on the strength that I got from my mom, right? So like my mom, I remember my mom telling this story because she had it took her a really long time, probably not until she was in her older age, to really understand, why is race so important? Why does it matter that you're a Mexican? We would have these conversations, and and she shares the story of working as a seamstress in the United States. My mom had a sixth grade education, but she was at least blessed to have received some skills training on how to sew so that she could work. And sharing the story of being at work one day in the United States, in Yuma, Arizona, which for people who are listening to this on the West Coast probably know where Yuma, Arizona is. It borders up against Mexico and California. And a man coming in, I don't remember how exactly this came up, but he felt it was okay for him to say that my mother essentially, so basically, I don't want to use any derogatory terms. I want to be really positive about this, but calling into question, this idea that she's a white woman with 3 Mexican sons. And having to deal with that. And so I can only base the work on my experience largely, not solely, but largely, which is that I need to embrace everybody. And I have this thing that I'm trying to encourage in our school, right? Which is that I want to create an environment where people can just be. I don't want you to be male. I don't want you to be Iranian. I don't want you to be Mexican. I don't want you to be Black. I don't want you to be anything. I just want you to be, right?
Be your own genuine self.
Just
be
be.
comfortable or have the safe environment to be your
Exactly.
genuine self.
Just be. That's it, right?
Yeah,
Like, we talk about belonging, right?
right.
Well, if we want people to belong, then we should just let them be. And so thinking about that, I'm not saying that's the right approach. Just I've been thinking about that approach, right?
Right.
That if you can just be, does it matter? Of course it matters, right? Who we are, right? Underneath that person that we are, all of that
Right.
matters. But if I can learn about all those different pieces or aspects of who you are by just being, I don't know. I just wonder what that would be like, right? Because I'm, trust me, I'm not naive. I realize we don't necessarily live in a society where that's, the way things happen. But I do wonder about that, right? As a person who, taking us back to your original question, right? Who has had experiences based in race, ethnicity, and sexual orientation, that if I didn't have to be based on those things, right? What would that experience be like? I just
Right.
wonder, right? Can I just come as Robert? Can Ali just come as Ali?
Yeah. I mean, from my perspective, like it makes sense because so many times we do label people and we try to put people in these boxes. And I think it's more or less to make other people comfortable, not necessarily to make the individual comfortable. Like, how do I need to be around?
Satisfy their curiosity,
Right. Right.
right?
Instead of just accepting the people
That's what it's
with who
always
they
been for
are.
me. It's always been
Yeah.
to satisfy their curiosity. But I do wonder, if I'm just being and we're having lunch together, let's say, right? And we're both
Right.
being, right? And I just say to Ali, I'm just like, hey, Ali, tell me about your family and where you, how that, like going back a few, generations ago. What was, where did they live and whatever, right? Like just having an open conversation about like just getting to know someone, right?
Out of an appreciation of them.
Yeah, exactly. That's
Yeah.
it, right? It's not just not trying that I'm trying to pry, right? Just like I just want to know about Ali. Like,
Yeah.
we talk about this country being a melting pot, right?
I call it more of a salad bowl, but
Exactly. Something like that, right?
yeah.
And I wonder, okay, if we embrace that idea, right? If we embrace that idea, right?
Right.
If one embraces that idea, then what does that mean? Do I never get to know Ali for anything other than him being a nurse and my colleague? Is that it?
Right.
Because that to me feels very superficial.
Like it's only a layer of the onion that you get to peel.
It's something.
Yeah.
Yeah,
It's
so
not everything that makes people who they are.
right.
So
Yeah.
having the opportunity to actually do a appreciative inquiry, sort of say, into who they are, makes them who they are. And I think we appreciate, like, our good friends, we tend to know a lot better and more about than others. So yeah, I can appreciate that. I can appreciate it. So definitely want to make sure I'm cognizant of how long I'm keeping you.
You can go
And I get
you can go
I
until
get
you
to
feel like you got enough.
I get to no I get to have these conversations with you all the time, so I appreciate that. I want to give you the floor of anything else you want to share, and if you want to just one last question I can throw in there. What do we need to do from a EDI perspective, as a profession or from an academic setting? What do we need to do a better job to make nursing a more inclusive profession?
That's a great question. I think it's the central question, what needs to be done, right? Because I think there are things that need to be done.
Right.
How we achieve doing those things, I think is going to take it's going to take many different strategies. And it's going to depend on the context in terms of nursing education and nursing practice and nursing professionalism. I think that certainly one area that we need to focus on, which seems like duh, is the representation of nurses in terms of how we are comprised to meet the representative needs of people in this country. We have a lot of work to do there, no doubt. And that's the duh, right? The less duh is, how do you do that? And I think that one area that we're starting to focus on at the UCLA School of Nursing is, and this has been talked about, but I'm not sure how much it's actually being implemented across the country, and to what extent it is being validated, which is holistic admissions into our programs. I think that that's something that we need to have much more attention to and somehow be much more accountable for within the profession. Because we can say we're doing it, and I can tell you that UCLA is doing it, but we probably aren't doing it in a way that is necessarily leading to us achieving the outcomes that we might be hoping for. And so that's one thing. I think the other thing, as I was thinking about our time together this morning or today, is I can tell you that we haven't done it at UCLA. I have been thinking about this. I've only been in the job for 19 months, and we may do this soon. Of course, it depends on the faculty and the community. But to what extent have individual schools done a deep dive, so to speak, about their own institutional discriminatory practices and biased environments? And have they at least made a statement about that? You know, we talk about men in nursing, and when you look at the data basically shows a flat line. We've been very stagnant over the last decade in terms of the number of men enrolled in nursing schools and graduating from nursing schools and in the profession. And what does that mean about our environments? Right?
Sure.
And so I think that's another thing that I've been thinking about from the moment I got to UCLA. But of course, there's many different things that need attention, and not making excuses for the work that we're doing at UCLA. But in fact, my role as Associate Dean for EDI is 50% of my time. So, you know, there's all sorts of work that needs to be done. But I do think that schools of nursing, if they haven't done it, and colleges, if they haven't done it, need to have a document or some sort of report that accounts for their own history. We have an interesting history at UCLA, you know, one in which, you know, some of our first graduating classes actually were comprised of white and Asian students. It's not just a discovery or a telling of a story that is negative, but also the positive things in that we may want to revisit.
Right, like things that happened that did diversify the population and contributed to that. Yeah, definitely.
Yeah. So that's on the student side of things. I think on the faculty side of things and the staff, because I don't want to leave staff out of this, because our organizations do not exist and function just with faculty and students. I think that on the faculty side of things, one of the things that we're focused on at UCLA in the School of Nursing is trying to create a pipeline of Ph.D. students from underrepresented groups. I think a lot of this work needs to be intentional. I think that for places like UCLA, I think that we're very attractive to all sorts of people, and sometimes not so attractive to all sorts of people. We need to really think about how we set a tone in our school, at least, to be attractive to everybody and not detract, send messages that detract people from wanting to come to be with us. And in doing that, we not only provide a service to the discipline, but hopefully provide a service to ourselves and get people to think about being part of the academy beyond getting their PhD. And then when we think about our staff, I think one of the things that we need to be mindful of is, because they oftentimes tend to be more representative of the people that we're serving in the profession, is that they are a critical part of everything that we do. And they're really our partners in ensuring that our students feel valued for who they are, whatever that is. And so I think that when the staff feel valued, it's easier for them, right, to demonstrate that value through their actions and how they support our students. So yeah, we have to be working on all cylinders, and it's challenging, because at the end of the day, we're dealing with human beings at the individual level first, and trying to create some type of synergy among many individuals.
Well, thank you very much. Anything else you want to share before we sign off for the season?
So I think as we move forward in nursing, I think there's clear evidence of the need to support students on their journey. One of the areas that I think that we can enhance in the discipline of nursing is thinking about what are the right processes and structures in place to help students succeed, all students. And sometimes that requires some intentional focus on student success and a closer attention to how we are clear about what the expectations are of students. Because my experience has been across all programs, from BS to PhD, that not all students necessarily either get the same message or hear that message as clearly either at the beginning of their program or at some point in their program. We have amazing people in all the institutions that I've been at. I've seen some amazing students come through these programs. And at the same time, these amazing students, some of them often struggle greatly to succeed. And I don't think it's because they are incapable. I think sometimes we just have not provided equitable support for our students. And sometimes that equity is not in terms of resources that cost the school something directly, but it's an investment in someone's time to ensure that that student is hearing the message clearly about what does it mean in terms of the time needed to be a successful baccalaureate student? What does it mean in terms of the time needed to be a successful PhD student? And really engaging them, not just in that conversation about, oh, you're going to need to put a lot of time in, but so let's talk about what that means to you, right? Because for some students, it might be that they're taking care of, they're the primary caregiver of a person at home that needs extra care, right?
Right.
For others, it might mean that, they're a single parent. I mean, there are many different things that sometimes we just don't know about our students unless we actually take time to learn more about them.
Right. Very true. Very true. Well, thank you so much. Thanks for your time. Greatly appreciate you sharing your journey with us. We have been listening to Dr. Robert Lucero. He is an Associate Dean of Equity, Diversity, and Inclusion at the UCLA School of Nursing. Thank you very much. This has been a fantastic season covering some incredible nurses with the focus on equity, diversity, and inclusion. And happy holidays. And I look forward to bringing you another season of incredible nurses in the profession for you in season 7. Thank you very much and have a great holiday season. You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources. And don't forget to subscribe. Until next time, I wish you fair winds and following seas.